You're listening to The Artist Athlete, Episode 7, You Lucky Duck. Hey friends, fans, and enemies. I'm Shannon McKenna, and I'm the host of the Artist Athlete podcast. This podcast is dedicated to Circus. It's a resource for those working in the industry to share our stories, viewpoints, and information, and a place for outsiders to get a sneak peek into our world. Thanks for the amazing feedback from you guys on Instagram and Facebook. I'm getting a lot of great emails, and I really appreciate everything that you have to say and all your suggestions. One of the things that people really are asking for is longer episodes, which makes me really happy because as a circus artist, everyone knows you always leave them wanting more. So that's great, and I would love to give you more. But right now, I'm producing this show on a pretty shoestring budget, so I can't really afford to make the episodes any longer. I'm playing with the idea of making a Patreon site and have longer episodes on that, but that's a project that's going to happen a little bit more down the pipeline. However, I recorded this episode with circus darling Jennifer Crane of Cirque Physio while we were giving a series of workshops around Germany and the Netherlands. And it had so much great information, and I had so much fun giving the interview that I didn't want to cut any of it, so I decided to make it a two-parter. So this week you'll hear us chatting, and then you'll have to wait until next Monday to hear the conclusion of us chatting. If you haven't heard of Cirque Physio or its founder, Jen Crane, you are in for a treat. And also, do you not have the internet? She's everywhere. She's a physical therapist, athletic trainer, board-certified orthopedic specialist, and she's a public author. She worked as a physiotherapist in China with the Chinese Olympic team in preparation for the 2016 Olympics in Rio, and 18 of the athletes she worked with won gold. Her practice is currently based at the San Francisco Circus Center, where she specializes in injury prevention and treatment of the performing arts, specifically circus artists. She was my PT and one of my favorite specialists to collaborate with for the Artist Athlete. Here's the first part of the interview with Dr. Jen Crane. Dr. Jennifer Crane with a bunch of other letters. What are all the letters behind your name?
All the letters. So the first one, PT, is just the designator that I am a physical therapist.
Okay.
Then after that, DPT means that I have a doctorate degree in physical therapy because you can either have a master's or a doctorate. So it tells what your highest degree is. So PT, DPT, OCS means that I specialized in orthopedics, and I spent a year after getting my doctorate specializing in orthopedics and sports and treatment of that population in particular. PT, DPT, OCS, ATC. ATC means that I'm also an athletic trainer, a certified athletic trainer, which is kind of like a physical therapist with a little bit less of a scope that focuses only on treating athletic sports populations. So that was what I did my undergrad degree in.
Gotcha.
And those are my letters.
Those are so many letters. How did you become a circus PT specifically?
First, you become a PT.
Okay, cool.
Very important first step. Some people try to skip that step. Doesn't work out so well.
Why not?
Well, you see, we have standards in sports medicine and in the medical field in general for a reason. So that you know if somebody is actually a physical therapist, that they have gone through extensive schooling, they've attained probably a doctorate degree if they're in America, and they have passed a standardized board certification exam, which means that they can safely treat an abundance of patient populations under the umbrella of physical therapy. Very important.
Yeah, I would say so.
So that's the first step. First, you become a physical therapist. And then so my path was very different. So I became, I was a physical therapist first and was working in sports medicine, treating different athletes, working with different sports teams, teaching, doing research, kind of like a bunch of different things. And then I kind of stumbled upon circus arts. And I have a background in dance and ballet. So the first time I saw someone doing silks in a rock climbing gym in Texas, I was like, that's super cool. I want to do that. Like, sign me up for that. I don't want to do rock climbing anymore. So I started doing aerial silks and hand balancing and acrobatics. And the more the more deeply I became involved in the circus world, the more I started to see that there was this huge lack of qualified healthcare providers who knew what to do with us, because most people and most of my classmates in my circus classes would be, having aches or pains or injury to some extent, and they wouldn't want to go see a physio because they had been before and the physio either just didn't know what to do with them and said, well, you're strong enough and you're flexible enough, so we don't know what to do with you, or they just gave them a blanket, stop doing what you're doing. Yeah. And that's obviously not
I've had those experiences.
Yeah, right. Yeah. So many of us have. So the more I kept hearing that, the more and more angry I became with the profession of physical therapy, because we generally have a really hard time thinking outside of the box, I think. And that was something that a lot of my training in different sports fields had encouraged me to think outside of the box a little bit. So then I found myself in this, in this world of circus where nobody knew what to do when they got injured. And then people kept getting perpetually more and more injured because they ignored it.
Can you give an example of that? Like, what is a time where you've had someone who's been like, oh, a PT told me to stop, but because you have that additional specialized knowledge, you were able to be like, well, actually, don't stop, but do this?
Sure. Yeah. So a lot of times, one of the most common injuries that I see is low back pain for various, whether it's a nerve irritation or for whatever reason they have low back pain, mostly because we do a lot of back bending and extension. So people come to me and say, I'm a contortionist, I have back pain. I've been to doctors and different physios, and they told me to stop because I would break myself if I kept doing this. And that's, I think that it's important to do the tests that you need to do to make sure that they're not going to further injure themselves more seriously. But a lot of times they just don't, a lot of physicians and physios don't really know how to test this population for a return to sport, which is something that is very commonly tested in other like sports physio fields. So we just don't have that criteria. So people will come to me with that story of low back pain and contortion, for example, and then I run through my tests, my clinical exams and tests to make sure that there are no red flags that make me think that they need an MRI or an X-ray or further imaging or to be referred to another healthcare provider. But if they don't have any of those, there are so many things they can still do and still train. And I think that that's really important from a psychosocial mindset too, that you can't take an athlete away from their team or their training environment. It's such a culture. It's such a, it's a
community.
It's a community.
Sure. Yeah.
And if you take someone completely out of that community, there's so many studies that show that has really negative impacts on their well-being, their just their mental health. And I think that it's just really unfortunate that PTs don't think about that when they treat this population, because there's so many things you can do if you have low back pain. You can still train, if they're an aerialist too, you can give them a list of things that they can do still for conditioning on their apparatus, or even if they, if they're just a contortionist and they want to still train contortion, give them a different program of things they can do that will help rehab their current injury while they can still, work on splits or middle splits or just leg flexibility, or take that time to work on active flexibility or shoulder. Like, there's so many things you can do if you have back pain or if you have an injury. It's just figuring out how to keep them in their environment so they don't go crazy. Right. Because nobody wants that. No. And that, I think that also encourages compliance too. I mean, one of the things that from a physical therapy standpoint that a lot of us are frustrated with is non-compliance. So we give patients exercises and tell them what to do and how to, get better so they can continue to train, and then they don't do it, which has not been my experience at all with circus artists.
Yeah, we're pretty compliant people.
They're so compliant. It's the greatest.
In the gym.
It's the greatest. Yeah. So I found that instead of telling people like, don't do this, say, here's what I want you to do this list of things. And if you set them up for success and give them a handout with photos and descriptions and are very specific with frequency and everything like that, that's so empowering because they say, oh, I have all of these things to do that will help me, that will help my condition, and I can still train and be with my community. And I think that that's so valuable.
That's awesome.
I love it.
So if people can't see you, or obviously like you don't, if you have an acre pain, like you don't treat your, maybe you do, I don't know. You probably have a lot of information, but if someone's looking for a circus specific PT,
sure.
This is a question I know you answer a lot, but I think it's a good one.
Yeah.
Is what do people look for in their communities to find someone who might be able to do the same thing you do?
Sure. Yeah. And I think that that's something that's the sticking point and the frustration, right? Is that
totally.
They want to be helped, but they don't know who to go to. So yeah. I think the first thing to do is find a physio that is actually a physio and graduated from a program. Like, let's make sure they're a physio first, again, because there's a lot of that floating around. I think especially in the circus and performing arts world.
Well, totally, because a lot of us have the same injuries or we have the same problems. And so then you start saying, okay, well, I know that this was my problem. And so I can rehab or prehab this thing. So I can give you this exercise to do.
Yeah.
But it becomes that line between like giving someone just like a TheraBand exercise and then diagnosing them with a problem.
Exactly. And everyone is so different and everyone's injuries are so unique that you can't just like hand your rehab program over to your friend for seemingly the same shoulder pain, because the reason that you get shoulder pain might be completely different. So you have to address what's causing that, which requires an evaluation by a qualified physio. So find a qualified physio. If you're in America, I mean, look at the credentials. Do they have a PT, DPT, or MSPT after their name? That's a really good first step. Super important.
Start looking at the letters.
Start looking at the letters because the letters do matter.
Yeah.
So do that first. And then after that, once you've found someone that you are confident is a physio, then there are a couple certifications that I think are really valuable. And that's the next few letters after their name. And I would say either having an OCS, which is what I have, which means you specialize in treating the orthopedic population, or SCS, which means...
And orthopedics is...
Orthopedics is like any aches and pains in your body. It is not people who have had like a stroke or neurologic disorder or a spinal cord injury. That's a separate subspecialty. So orthopedics is pretty much any injury that we would get in circus where you hurt yourself.
Gotcha.
For the most part.
It's like muscular or bones.
Sure.
Okay.
Yeah, musculoskeletal injuries. So OCS, that's what OCS means and designates. And then SCS is sports certified specialist. And that I think is also a really valuable bunch of letters to have after your name, because that indicates that you've spent at least a year after getting your doctorate degree working with and learning about how to treat a sports population. And actually, I find that this is almost more valuable than just the OCS. And that's because a lot of physios who work in a standard orthopedic insurance-based clinic don't really, you learn a very basic, I mean, you have the basics of treating musculoskeletal injuries. And I mean, if you have an OCS, you have an advanced knowledge of this, which is very, very useful and very helpful. But SCS, if you have a sports specialty, then you really get a lot more of the psychology of the athlete. And I think that that's something that a lot of clinicians in a standard outpatient clinic that I have experienced don't have. And I think that that's really valuable. And then, I mean, also you get a lot more information on progressing exercises and how to prescribe exercises that are specific to different athletic populations. And it teaches you how to think differently. And the reason that I got my OCS instead of my SCS was because I already had that knowledge from being an athletic trainer and being a certified athletic trainer for 10 years or whatever at this point. Because athletic trainers do that. Like, they just work with sports teams. They have advanced knowledge into the psychology and exercise prescription and functional exercise, and kind of that gap between standard physio exercises and return to participation in your sport.
Yeah, it's like functioning in normal life versus like functioning on stage or on the field or wherever.
Exactly.
I know with me, like, even if I'm going to go to a massage therapist or a chiropractor or someone who's not, has an advanced degree, but is just a body worker, I'm always looking for the person who treats some kind of sports team or somebody in a ballet company or somebody who's related to my field in some way.
Right. And I think that that's really the best option. So after you look to see if they have OCS, SCS, or ATC, those are the certifications that I think are really valuable. But then also, if you want a body worker, I think that there are other letters after the name that are really good that indicate that this physio has spent a long time working on progressing their manual therapy skills, which is what we call body work in the physio world, is manual therapy. Manual therapy. So the letters that you would look for if you're looking for a body worker that is a physio that has this kind of more advanced knowledge about treating, rehabilitating, diagnosing sports, different athletes, is FAAOMPT.
Woo!
Starts with an F, ends with a T, a lot of letters in between.
We should put in the show notes just a glossary of all of the acronyms so that people can look and find people corresponding.
It does matter. And that's the degree, or those are the letters that you want if you want somebody who's going to do body work on you. And I think that that's really valuable too.
This podcast is brought to you by The Artist Athlete. Did you know that The Artist Athlete is more than just a podcast? It's a growing online resource for students of the aerial arts to deepen their journey to badassery by accessing techniques approved by physical therapists and master coaches in the industry. Our current spotlight is on the fundamentals of aerial alignment, a practical manual for hanging upside down. This online manual is a step-by-step guide. It is complete with photos, videos, and exercises that you can implement immediately to help you gain the strength and awareness you need for an aerial practice that promotes shoulder health and longevity and good posture upright, so you don't walk around like a gorilla. But don't just take my word for it. Here's Circus physical therapist Dr. Jen Crane of Cirque Physio to tell you more.
The fundamentals of aerial alignment is an absolute must-have for every aerialist of every level. I can't even tell you how many shoulder injuries I treat that are a direct result of rushing past the basics in an attempt to get a trick too soon. In the manual, Shannon deconstructs the fundamentals, including the correct muscular engagement to safely arrive in these positions and the rationale for why it matters. Of course, in addition to all of these fabulous pearls of wisdom, the book is also ridiculously fun to read. It's been lovingly garnished with the Shannon humor we all know and love.
Thanks, Jen. Cirque Physio is also featured in the book to give scientific insight into why it all works. Pick up your copy today by going to theartistathlete.com and clicking e-manuals. Listeners of the podcast can get a 10% discount by typing in the offer code PODCAST at checkout. Again, that's theartistathlete.com, offer code PODCAST. Now, back to the show.
Yeah, one of the questions I had on Instagram, which I thought was really cool, is so you have your PT, but if you also want to build, if you have unlimited resources and you want to build your arsenal of body workers and people for just maintenance, what would you recommend in that kind of cocktail or that army of helpers, massage or, I don't know, acupuncture or chiropractic? What would be your prescribed regimen?
Yeah, that's a really good question. I would say obviously a physio who has some of those certifications is number one. And then if that physio does body work and does manual therapy, then you probably just they can fill a lot of gaps for you. If they don't, or if their clinic is set up in such a way that doesn't really fit into their schedule, then I would say a massage therapist or someone who is a body worker who is licensed in their field.
Right.
So if they're a massage therapist, are they licensed in the state that you live in? Pretty important. Super important to have that. I think that acupuncture can be really great. I think sports acupuncture has some really interesting research behind it. But I think that also, and this is something I know we've talked a lot about, is dry needling, which is a technique with acupuncture needles that applies the needles in more of a Western thought process approach. So instead of putting the needles along the meridian points and with the chi and all of that, it's more based on what muscle is quote unquote dysfunctional.
How do they know that this works?
Yeah, there's been a lot of research.
I love this story. It's like with horses, right? They found this out.
Yes, I believe, and it's been so long since I've looked into this, but I believe the origins of this were with racehorses and using acupuncture needles on racehorses. So that's one of the origin stories. And then the other, how I think dry needling came to be known as dry needling, is there was a doctor in Canada, I believe, who he was looking at trigger point injections, which is when they take a trigger point, which is like that tight band of muscle that you get after when you're really stressed, and they would inject like a numbing agent or some agent into the trigger point, and that worked really well, and that helped to decrease people's pain and improve function so that they could then move in a more productive manner to rehabilitate their injury. So they found that these trigger point injections worked really well. And then this doctor was like, hey, what if the therapeutic agent isn't what we're injecting? What if it's the needle? So he did an experiment where he still put the needle into the trigger point, but didn't inject anything to see if they would still have a positive outcome, which they did. So that's so cool.
Isn't it cool?
Yeah. I love it.
It's so cool that he like got to that conclusion, or just said, what if we take out this and just stuck the needle in? Yeah. And it had the same results.
Right. Or like so many of these medical advances come from just some random person being like, hey, what if, or like, what if that's not the story? What if he actually just ran out of the solution? Like, that's a definite possibility.
He was like, well, you're my last patient of the day, so sure.
Yep. We'll see how that goes. Maybe, I mean, who knows?
Yeah, totally.
We don't know.
That's great. But it's great. Like, I am such an advocate of it.
Yeah.
Because I think it's just the best way to relieve a quote unquote injury. And maybe this is something that I want to also discuss with you, is this idea of like aches and pains versus what is an injury.
Yeah, definitely. So an injury, and this is something that's unique to circus artists that I found as well, is that circus artists really don't like to say that they are injured or call themselves injured. Mm-hmm. They will say, so in my workshops, one of the first things I ask is, if you have a current injury, let me know so I can make sure that we tweak things accordingly or that nothing exacerbates it. And when I ask like who has a current injury, no one raises their hand ever. But then I'm like, okay.
Yeah, throughout the workshop, you get people who are like...
Yeah. But then my next question is, okay, who has like a shoulder thing going on? Or like a little thing in their hip? Or an ache or pain or something that we don't call an injury. And everyone's like, oh yeah, I have a hip thing.
Yeah.
And it's...
Because to me, an injury would have to be like, my femur would have to be like coming out
right.
of my thigh or something, you know, like in order for me to be like, I am injured.
Right. Yeah. Or like, I think too, a lot of it comes back to we're used to having Western medical providers tell us to stop training if we say we are injured.
But I also find the opposite and is true as well, where people, especially people beginning who don't know what it's like to be like intensely sore.
Yeah.
Or have these kinds of just like throbbings or things like that.
Yeah.
And they say, I'm injured, but they're not. They're just really sore.
Right.
And like, how do you distinguish between
what's the
all
cutoff?
Of that? Yeah.
I think the first thing that I want to distill from that question is this concept of what is normal pain in circus. Mm-hmm. And I think that this is also very skewed because a lot of us hear circus hurts, push through it. You know, if you do hoop or silks, or, I mean, no apparatus is comfortable. So there's pain associated with most of what we do. And then if you have a beginner, how do you teach them what is productive discomfort versus non-productive discomfort? And I think that that's something that's really important for instructors to start following up with their students on, because oftentimes students in class will say like, ouch, or wow, this really hurts. And then a lot of instructors will be like, yeah, well, this is silks. That's the wrap. It's going to hurt. But what if they mean when they reach their shoulder up and pull and engage their shoulder, they have shoulder pain? That's not normal. So I think that it's important for us as coaches to start requiring a little bit more consideration and thought to go into our follow-up questions.
Sure.
And I think that that's something that's super important to start with. And then we can kind of go into, okay, what's productive discomfort versus non-productive? What's muscle soreness? Does it dissipate within 48 hours after you do your class or whatever it is that makes you sore? And then a question or something that I like to describe productive versus non-productive discomfort within, like when you're in a class, is so the student says it hurts. And then you can follow up by saying, is it a wrap? Is it whatever? What's causing the discomfort? And then you can ask them, does it feel like if you keep doing that, it will help you or harm you? Mm-hmm. And I think that that's something that's really important to discuss as well, because skin the cats suck.
Yeah, but they shouldn't hurt.
But they shouldn't hurt. And I think a lot of people just don't have that vocabulary.
Sure.
So if people are whining about doing a skin the cat and they're like, oh, my shoulders, follow up on it and then be like, okay, well, does it feel like if you keep doing this, it will make you stronger? Or it will give you a shoulder injury? Mm-hmm. And I think just even teaching students that that's the thought process and that's like the flow chart.
Yeah, sure.
Is a really good way to start. So I think that going back to the question, what's an injury? I think it becomes an injury when if it lasts over, several classes, if you have the same discomfort in your shoulder when you do the same thing, if it's exacerbated by a predictable movement. For example, every time I do a flamenco grip, grab the silks and put weight on my arm, it gives me shoulder pain in the front of my shoulder. If that continues over more than 2 to 3 classes, I think that's an example of something that could lead to an injury if left unattended. So that's a really good time to go in and get assessed by a physio. Another thing that I think about with an injury is, are you altering your training because of it? Are you consistently altering your training? And then I think that's also a time that's worthwhile to go in and have someone take a look at it.
That makes sense.
It's a loaded question. There are a lot of things to think about.
I know. There's so much to think about with it. And it's almost like we need extra words or extra vocabulary for it. But I think injury becomes like the catch-all for a lot of things. So
definitely.
It's really nice to hear those delineations.
It's interesting how it changes among cultures too, because like when I was in China, I would be working with an athlete and working with a translator, and there was no translation for good pain. So how we kind of talk about good pain, like when you get a massage, it hurts, but it hurts so good.
It hurts so good.
There's no translation for that. Really in China. So it's interesting how it works, how you can work around, or how you have to think differently depending on what culture you're in and what their culture is around pain and training.
Can you talk a little bit about, I feel like, I don't know, maybe people know this about you, but I think it's really cool. And I always would be like, yeah, my physio's not in America right now. She's actually training the Chinese Olympic team. Can you talk a little bit about your experience working with that population?
Yeah, absolutely. So I lived in China for about 8 months leading up to the Rio 2016 Olympics. I was working with all of the different Olympic teams. So I kind of bounced around between different teams depending on who was traveling, who needed a physio, who had the most injuries. So what
sport had the most injuries?
Oh, that's a good question. I want to say fencing.
What?
Yeah.
Fencing?
Fencing. I think that
they just get flesh wounds from
I did not treat any flesh wounds.
No flesh wounds.
I don't do flesh wounds.
Okay. No blood.
No blood. I think fencing was the most injured, the most significantly injured.
Okay.
I think that, gymnastics also had a lot of injuries. They had a lot of bad injuries. You can kind of stratify, like it's either an injury that you can continue to train through or it's an injury that you can't continue to train through. And gymnastics had a lot of bad injuries that people could not train through. Who else? Weightlifting was fine. They didn't have a ton of stuff going on.
Interesting.
Surprisingly. Divers were okay. Divers were like low-level injured. Like everyone was just low-level injured all the time, which I think is how you can talk about the Chinese Olympic teams in general. Everyone's low-level injured all the time.
What is low-level injured? How would you define that?
Everyone has some sort of injury that has been persisting for at least a year that they just train through, because if they don't train through it and if they complain about it, they will be replaced by someone of equal talent and then they will lose their shot at the Olympics. Because China is such a huge country and there are just so many high-level athletes in China that they know that. And then, I mean, their perception of their culture surrounding pain is very different than ours. So if they, you know, whine about something or talk to their coach about something, they may be kicked off the team. And they also just have their approach to training is very volume intense. So they think that more is always better. Training more is always better than training less. They don't take rest days ever. Sometimes they'll have half a rest day on Sunday. So a lot of that lent to a lot of chronic overuse injuries.
What was the most common injury on the ping pong team?
The ping pong team.
My thumb.
My pongers. Yes, the ping pongers. The most common injury was low back pain for them, actually.
Really?
Yeah. If you've ever watched Chinese ping pong, it's a very rotation intense endeavor.
Okay.
When I play ping pong, there's no rotation. There's also not a lot of the ball hitting the table.
Cool. So I know that's a weird place to cut the interview, but from there, we just kind of talk about ping pong for a little while. So I figured I'd cut it off. And then next week, we'll circle back around to Circus. I promise. I wanted to give a little bit of a recap for this part of the interview, though. At the beginning of the interview, I asked her about the letters in her name, and the reason I did that and what we kind of start to point towards is this idea of scope of practice, which is a super medical term. In the healthcare field, it's defined as the procedures, actions, and processes that a healthcare practitioner is permitted to undertake in keeping with the terms of their professional license. How is this relevant to Circus? Well, as an aerial coach and not a healthcare provider, my job is to show you how to do a skill or a trick in a safe way, and I can help problem solve why a trick isn't working, or I can also help you with your quality of movement. I can help you with your artistic expression, and that all requires that I have some insight into biomechanics and anatomy. But maybe like 2 or 3 times a week, I'll get a DM on Instagram with a message like, my shoulder hurts when I put it over my head. What's wrong with me? Or my knee makes this noise when I wrap it. What's wrong with me? Or my eyes hurt when I stare too long at the sun. What's up? And as an aerial coach, I'm not really qualified to tell you what specifically to do because of that ache or pain. Except for the staring into the sun thing, I think anybody's qualified to tell you what to do about that. But the rest of them, that's a job for a physio. And so even if I have an idea of what might be going on with you, I really don't have enough information about everything to screen you or tell you why you're in pain. For all I know, your shoulder could hurt because you have a tumor. And if I had a higher budget, this is where I would insert Arnold Schwarzenegger from Kindergarten Cop saying, "It's not a tumor." But I wanted to make that really clear to people. The job of an aerial coach is not to tell you what your pain or what's going on with you. It's to help you excel. It's to take a normal person's body and bring it to superhuman strength. Now, if you don't feel normal yet, that's when you want to start to see a physio. And this line between productive and non-productive pain can seem really blurry, but Dr. Jen, I love calling her that, has a great way of telling the difference. The questions that you have to ask are, if I keep doing this, will it help or hurt my training? And am I altering my training in some way because of my pain? In both cases, if the answer is yes, you want to see a physio, because the goal of training is not to keep hitting the same wall and feeling the same pain, or avoiding that wall altogether and thus not getting over it to find the next step. You want to get better. That's why we go in the gym every day and work on these things. And unfortunately, just like as the rest of life goes, a problem doesn't really get better if you ignore it. We also learned this week to stay away from the sport of fencing, because apparently it's really dangerous. No offense to all you fencers out there in the world. If you like the podcast, Please tell all your friends about it. Subscribe, rate, and review on whatever platform you're listening on. You can find me on Instagram. I'm at _artist_athlete and online at www.theartistathlete.com. You can find Jen Crane on Instagram at Cirque_Physio or at www.cirquephysio.com. See you guys next week. You know, I really need a good, signing off catchphrase. Does anybody have a good suggestion for me about signing off catchphrases? If you have a good idea for me, email me, and maybe I'll use it and give you a shout out.